Just relax this right shoulder. Good. Relax the left. Good. What's up guys, Dr. Drew here, back in the channel. Thanks for watching this video. If you haven't already, make sure you hit that like and subscribe button below. It truly helps us out. So today I'm here with Brandon. He's been a patient with ours for almost 2 years. We just took a look. Originally, Brandon came in with some lower back pain. We took x-rays, noticed that he had a little bit of a curvature or scoliosis. We're able to fix that through adjustments, physical therapy, and a specific technique called chiropractic biophysics. Currently, he's in more of a maintenance phase as well, so we're constantly battling his day-to-day activities from being a corporate worker to adaptive to, as well as just constantly wear and tear on the body. So I'm just gonna have Brandon tell us a little bit about himself, what he likes to do here, what we've done as far as his treatment, his day-to-day normal activities of daily living, and how it's kind of triggered his discomforts as well, and then what we're doing currently. So Brandon, just tell the viewers a little bit about yourself and what's going on.
Thanks, Doc. So my name is Brandon Dombrowski. I've been coming here for, like you said, almost 2 years. Originally, I sought out Doc after moving nearby in Arlington Heights. Originally, I'm from Arizona. I moved here in 2017, and I've always had back pain my whole life, being taller, hit 6'6". When I was younger, I played a lot of basketball and other sports, and continued that till I was about 26 or 7, until I had a pretty bad ankle injury. And long story short, my back has never been good, but Doc has done a great job of working with me and doing various things here in the shop. As far as stretching, doing Scoli, which is an activity where I'll lay down and it'll just adjust myself and make me feel a little bit better. The decompression machine is one of my favorites. It basically helps decompress my spine to a point where I'm not feeling the day-to-day from going on the train and hanging out with the kids, picking them up, doing all the various things my wife's making me do. So overall, I'm very happy with some of the results we achieved with my lower back. I still have the upper back pain from just being a day-to-day office worker, so we're working on that. But overall, I mean, I'm very happy here, and you guys should definitely check him out if you're having some of the same issues.
Thank you. Yeah, so just to kind of recap what Brandon said, obviously he's a corporate worker, he's super tall at 6'6", so again, he's been an athlete his whole life, so a lot of injuries and traumas kind of been led up to this point, as well as you guys know that have young kids, you're constantly bending, lifting, and moving with them all day and every day, so you're in odd positions, you're carrying them, whether it's a diaper bag, your kid, or vice versa, giving them a bath, bending over, things like that. So as well, being a corporate worker, just hunched over, and again on those metro trains, they're not ergonomically friendly to the body. So what we're going to do today is we're going to go through a full workup with Brandon. We're going to do some shoulder work as well on his right shoulder, just do a little bit of trigger point ART, some active release techniques, and then we'll do a big decompression at the end. So make sure you guys follow to the end of the video. We got a cool little trivia fact as well, but appreciate you guys watching this video. We'll have you just take a seat here first, and we're just going to do a little bit of some trigger point stuff and then go from there. All right guys, so first thing we're gonna do is just warm up his traps with this muscle massage gun, our Hypervolt here. Super easy. I'm just gonna do nice light pressure. We wanna go all the way up and then all the way down. Just working through that muscle. You can even see how tight it is right here. It almost looks like a guitar string or like a band consistently, but we're just gonna work it all the way up and all the way down. Just get a little bit of relaxation in that tissue before we start to aggravate it with some of that trigger point work. What I also like to touch on too is we like to do a lot of work with his lats, as well as these teres minors, these posterior deltoid muscles too, with our lacrosse ball in a couple of our therapy rooms before he gets adjusted as well. So he's already done all that stuff. He's warmed all this tissue up. Now he's just going to get adjusted, realign everything, and make sure everything's back to where it should be. Especially being a big guy with big broad shoulders, you're going to see he's very anterior dominant, so these shoulders are kind of rolled forward. Essentially you want to have your ear match up with your shoulder just like that. Perfect, Brandon. Awesome, good correction there, buddy. All right. Yeah, so next thing we're going to do is a little bit of ART, some active release treatment. So I'm going to have you with your arm out like this, okay? First thing we're going to do is I'm going to find these trigger points. I'm going to work his arm all the way across, okay? So we're going to find that trigger point here. I'm going to have you bring your arm all the way across. What he's going to feel is that we're going to go over some knots or some big kind of hills as they say. As we go through them, we're gonna let that muscle glide over my fingers and help break up some of that scar tissue. So we're gonna find it here. Good. Go ahead, bring that arm all the way across. Good. Reset. Good. A little bit slower. Good. Good. Perfect. Good. Now from here, I want you to go all the way up across your body.
Okay.
Good. Good. Reset. Good. I want you to hold it right here.
Okay.
Stretch. Good. Good. Do some passive motion now, where I'm passively going to move his arm through. And a lot of times too, when we see scar tissue in here, it's constantly moving. So the same spot that he had last time I saw him is different now. It's very common for that tissue to slide and glide. Good. How's that pressure?
Perfect.
Good. Right there. Good.
Being a shoulder sleep, it doesn't help.
Yeah, we're gonna get the shoulder adjusted now, so I'm gonna reach around, guys. Just relax the shoulder. Good. Beautiful. Awesome job. All right, guys, we're gonna go on to his spine now. So Brandon, we're gonna have you go ahead and lay chest down for me. Facing the paper here. Same thing as always, we're gonna warm up this tissue all the way from the lower back, all the way through. Especially after a long day of work here, about halfway through the work week. What would you say, besides the adjustment and the decompression, is your third favorite?
For me, it's the stretching, because I don't get a lot of time to get away from everything, and unless I'm waking up early in the morning or I have a break, it's the stretching that really helps me as well. You guys got a few of those machines here that allow you to do those different exercises, which definitely help.
Yeah, just being consistent, guys. You don't have to stretch for 2 hours a day, but a little bit every day adds up over time, and by doing that, the results show up. Just like if you guys wanted to lose weight, you can't work out for 2 hours, once a day and then expect it to just shed off your body. It's a process. All right, next thing we're gonna do is work from the pelvis all the way up. Piece is gonna pop up. Good, we're gonna adjust his hip. Good. I'm gonna work my way through the middle of the back here. You guys are gonna hear some popping and cracking. They're just gas escaping the joint. Good. Good. Perfect. Just relax this right shoulder. Good. Relax the left. Good. A little bit of... Pressure okay still?
Yeah.
Okay. Let's adjust this right side so we'll lay it on your left. Gonna attack this lower back here and pelvis. Good, other side. So what was for dinner?
I think we've got a little Mexican taco.
Okay. Nice. Good. Awesome. On your back. A little bit of stretching here in the pec as well. We're gonna do both sides for Brandon, especially being that corporate worker, hunched over all day, at your desk, on the train, with kids.
I definitely try to use the standing portion more, but it's tough.
Yeah, we've installed as much as we can an ergonomically friendly desk, whether that's standing or properly sitting for Brandon, but just him being so big and tall, the desks are not made for tall people. Good. Let's see the other side. Oof, this pec is tight.
Can't drop the beam.
Yeah. Good. Good. Should loosen up though. Especially after all this trigger point stuff, guys, we want to make sure that we hydrate. We always tell patients to take your body weight, divide it by 2. That's how many ounces of water you want to typically drink. Feel that little pop there?
Oh yeah.
Good. Perfect, awesome. Okay. Last but not least, we're gonna do the decompression on Brandon. So scoot back a little bit for me. Good, and lift your head up. Good. So nice and easy, we're gonna take our time. Slow and steady. Just breathe. Do a couple of these pulls. Most important thing is just relax. Good. Doing okay? Good. Just stay right there. How far did you feel that?
All the way down.
Good. A lot of times, guys, it'll take your breath away, so take your time. Take your time, but that's massive for a guy this tall to decompress that spine, especially if he's got a little bit of curvature still in the spine. Before coming up. Well, thanks for watching this video as well, okay? A little trivia fact about me is that I played semi-professional rugby as well as played for Team USA for 1 year. You guys can Google me as well. It's a little trivia fact about us. But Brandon, thanks for watching this video as well. Thanks for participating. We'll see you guys in the next one.